Welcome to episode 5 on my series on polycystic ovarian syndrome. In this episode, we're going to discuss severe polycystic ovarian syndrome. The features of this manifestation are these women sometimes never have periods, or they have very irregular periods. It's not uncommon to have a woman go up to a year or two without a spontaneous menstrual period. These women tend to have what we call an apple-shaped frame. You can recognize them across the street. Women with severe PCO frequently have very slender thighs, sometimes very small breasts, and all of the weight is in the midsection. These women can have acne, but their biggest cosmetic problem is generally hair growth. They can have full hair growth, equivalent to a male beard. They can have abdominal hair growth, all other places as well. So this is generally very striking, and it's very easy to diagnose. Now, women with severe PCOS are truly at increased risk for diabetes, and many women come to me already diabetic, usually type 2. Women with this condition have frequently already lost their gallbladder from all the inflammation of the liver and the terrible diet some of these women eat. Their gallbladders are long gone. These women frequently have high blood pressure, and their whole body is inflamed. So you see all kinds of related inflammatory conditions. One of them is asthma that you wouldn't normally equate with polycystic ovarian syndrome. These women generally have very high insulin levels. Eventually, once the pancreas burns out, it can go down, but usually insulin levels are very high, although we generally don't measure them. Now, when a woman is this severe and she has these stretch marks that have purple tips on them, these women are at higher risk for something called Cushing syndrome or congenital adrenal hyperplasia. And we generally look for these concurrent conditions or these conditions masquerading as severe PCOS. But once again, these are still fairly rare, generally less than 2 or 3% of the patients we see with this presentation. Women with severe PCOS who are overweight are tremendously resistant to losing weight. You can calorie restrict, you can exercise, and these women just don't lose weight. It's very, very difficult. Now they can, but they hold on to weight like nobody's business. Now, I've discussed this earlier. In order to understand a flavor of PCOS, you need to understand the genetics or the adaptations of these genetics for various conditions. Women with severe PCOS are clearly adapted to very harsh conditions. Severe drought, plague, food shortages might go on for a long time. And once again, in these conditions, these genetics can flourish. But how do you manifest this or recapitulate this in the modern world? Well, it's difficult. We see severe PCOS more likely in some ethnic groups. Women who are Native American, famously Pima Indians, at least half of them are diabetic, and they have this typical apple-shaped frame, although white women, black women can get it as well. It's not exclusive. These women have very high insulin levels, and the only way for them to lose weight effectively is to lower their insulin. This is done by carbohydrate restriction. A woman with high insulin with this body type, if she even looks at a piece of bread, a donut, a sweet, her weight will go right back up and she will resist weight loss. In fact, what compounds the problem, one of the reasons these women tend to have very skinny thighs and arms, is they lose muscle. Not only is insulin high, but adrenaline and adrenaline-like hormones are high, and this causes muscle wasting. So it's a double dose of increased fat and inflammation and decreased muscle, which decreases metabolism and lowers growth hormone levels. So women who are overweight, apple-shaped, with severe PCOS are in what I call a metabolic emergency. In these cases, we cannot mess around. They don't have much time and will take generally very forceful and persistent measures to get this condition under control. It does not go away. The body shape does not really change that much, but certainly fat and muscle distribution can improve, and these women's health can be turned around. But you cannot pussyfoot on this condition. You must treat it aggressively. Frequently we'll add medications, which we'll talk about in a later episode, but something must be done because these women are deteriorating rapidly, and not only is fertility curtailed, but in fact their lifespan is greatly reduced as well. So severe PCOS, not to be trifled with, should be treated aggressively.